I'm Dr. Michael Westerman. I'm a clinical psychologist. I'm a member of the Taconic counseling group, and I'm on the faculty of the psychology department at New York University. I'm also a member of the consulting faculty at Beth Israel Medical Center. I'll be talking about some of the things we know about psychotherapy that you might find interesting and useful. A lot of it is about individual psychotherapy. Most of it is also applicable to marital therapy and family therapy as well. Therapy has been shown to be effective. It's effective for a wide range of problems, and for adults in individual therapy, children in individual therapy, for couples in marital therapy, and families. Not all people, but many obtain significant benefits from being in psychotherapy. It's also been shown that the effects of psychotherapy tend to be more long-lasting than pharmacological treatments. That's treatments that involve the use of medications. Although often psychotherapy and psychopharmacological treatments are used in combination. One surprising finding from research is called the dodo bird effect. This effect gets its name from Alice in Wonderland, and it refers to a race that the dodo bird orchestrates in Alice in Wonderland. All the characters run around a table again and again until the dodo bird declares that the race is done and all have won, so all must have prizes. Psychotherapy researchers refer to a whole set of their findings as showing the dodo bird effect because they too have found that when they compare one kind of psychotherapeutic approach to another, they typically end up equal in their effectiveness. Although the findings showing the dodo bird effect are puzzling, there are many other things about psychotherapy that we do know. For example, one thing we now know is that certain therapists are more effective than others. So even though we can't identify certain kinds of treatment approaches that are better than others, we now know that certain particular therapists are especially effective in their work. Another thing we now know is that the therapeutic alliance is probably the best predictor of outcome in therapy. The alliance refers to the working relationship between the patient and the psychologist as they engage in therapy. This is one of my main interests in my clinical work at the Taconic Counseling Group. It's also a key focus for my colleagues in the Taconic Counseling Group. And it's something that I focus on as well in my research at NYU and Beth Israel Medical Center. It makes sense that the therapeutic alliance plays such an important part in psychotherapy because the psychologist-patient relationship is a different kind of doctor-patient relationship than most others. In many other doctor-patient relationships, the doctor tells the patient what to do or perhaps employs certain procedures. By contrast, in psychotherapy, the psychologist and the patient are engaged together in a collaborative attempt to work on personal issues. Research has shown that therapy works better when patients are open, including voicing disagreements with how things are going in the therapy. Another fascinating and important idea, one which current research supports, is that a person's problems are likely to occur in the therapy context itself. So for example, if someone's struggling with difficulties controlling their anger, that's likely to come up in their relationship with the therapist. Or for another example, if someone is very hesitant to rely on others and to ask others to help them, that will probably come up as a problem for the person as he or she engages in therapy because, of course, the issue of asking the therapist for help is a very central part of what should be happening. This phenomenon is likely to occur, and when it occurs, it's likely to lead to difficulties at some points in the therapy process. But current research has shown that working through those difficulties when they do come up can contribute to positive outcome. I hope you find these ideas interesting. Many questions remain to be answered, but we know that psychotherapy is effective. It can help people overcome their problems and improve their lives.